Hi, everyone. Thank you for joining us again on the Ethos podcast. I'm Kelly Wong, an editor at Ethos, and today I'm joined by Professor Andrew Cook, who is a clinical assistant professor at the University of Hong Kong and also serves as an honorary associate consultant at Queen Mary Hospital and Grantham Hospital. Thank you for joining us today. So as we know, you're an ophthalmologist, but as a kid, was there any other career that you wanted to do first?
I have to be honest, I think I never thought about doing medicine in the first place. I mean, I knew I enjoyed sciences as a kid, but at the time I was really into video games, right? So I went up to my mum and dad and told them I wanted to be a professional video gamer or a video game producer, and of course I got the, backhand, forehand slap saying, no way. I guess I had the, not in a negative or a positive way, but I had the very stereotypical Asian response from my parents saying, oh, when you're older, you got to do something professional, doctor, lawyer, architect, accountant, that kind of thing, right? So because I enjoyed sciences, so I thought, oh, why not medicine then? I think I'm really glad that that I did, because I actually genuinely do enjoy it. And I know, unfortunately, a lot of people who don't enjoy it and went into it for slightly different or wrong reasons, and that they kind of come out of it still not really, happy with that decision in their lives, which was maybe made for them by their parents, right? Which is a shame. But I did enjoy it. And then why ophthalmology? I mean, that was, again, I think something which was just, fate landed onto me. I think once I knew I wanted to go into medicine, at the time I was very influenced by doing something like plastic surgery. I thought it was really cool, just to change, a bit more artsy, you know what I mean? So a bit more creative within the field. So I thought about plastic surgery, and then when I graduated med school, at my hospital, I practiced in Liverpool for those junior years in the UK, and there wasn't a plastic surgery department, but there was oculoplastics, which is plastic surgery of the eyes. So I was on A&E at the time, and then I had a random half day off, and I thought, okay, why not, let's go have a look. And I went there and I was like, wow, this is pretty cool. I've never seen any ophthalmology surgery before. I have to admit, I actually bunked all of my ophthalmology lectures at uni, so that wasn't very good. So it was my first time seeing stuff like cataract surgeries and then oculoplastic surgery, and I was like, that's pretty cool. And so before I left the UK, I'd done the Hong Kong licentiate exam to come back, and they knew I was leaving, so they were like, oh, you've got a few months before you go, do you want to join ophthalmology for a while? We have a few people who are on maternity leave or long-term leave, so do you want to help us? And I thought, why not? So that's how I got into that. Wow. And then came back, did the internship, and then wrote the letters to all the COSs, expressing that I'd done ophthalmology before, keen to pursue a career in it. And here I am now, I think 10 years on, I think, yeah. That's
really cool. Because I think lots of people have heard of plastic surgeries, but maybe not plastic surgery of the eye.
Right. Yeah. There's a lot of crossover, I think. So now I'm doing oculoplastic and orbit surgery, which does a lot of the exterior, handles a lot of the exterior problems of the eyes. So the eyelids, the orbit, things behind the eye, the globe within the orbit, things like that. There's a lot of overlap between plastic surgery, ENT, neurosurgery, and I personally quite like that mix.
That's really interesting. So you mentioned you went to the UK and you were born and raised there.
Yeah, so I was actually born and raised there. Went to primary school near where I live. My parents lived in northwest London, somewhere called Harrow. And then for secondary school, I went to the boarding school, Harrow School, and I had a great time there. Then I went to Imperial College in London, and then I met my now wife there. My girlfriend then, now wife, if that makes sense. Make sure I get that right. And then, we finished Imperial. We thought I've had enough of London, having been born and raised there for my whole life. So we went up to Liverpool, which is her hometown. I had a great time there. And then that connects the story with, ophthalmology and then coming out to Hong Kong.
What was the education like there?
In the UK?
Yeah.
I guess, looking back, it was a lot of fun. A huge exposure. I think London, similar to Hong Kong as well. It's a very international population. When I was in primary school, I had a lot of friends who were Central Asian. So a lot of Indian friends, Pakistani friends, friends from different cultures. A lot of people who were Jewish and people who went to a lot of Hindu celebrations as well. And I felt like I grew up with a lot of those cultures, which influences a lot of my arts taste and my music taste today, right? I still listen to a lot of Bollywood music, believe it or not. And yeah, I just thought it was a really privileged, upbringing, having had so many exposures to these cultures, being really good friends with these guys. For me, I look back and I think my highlight was being at boarding school, which was Harrow School. I mean, again, it's really privileged. I know how lucky I was to go to somewhere like that. But why was it so good? I guess it was because, we were split into houses. And my house was called Bradby's. And there were, I think, approximately 15 boys per year.
Wow.
So in my year, the 15 of us, we just got along really, really well. We just gelled really well. And they're always like a second family to me. They are, even now, we're like, I don't know, nearly 20 years on from school, but we are always in touch. Whenever we go to other countries where they might be, we're like, oh, hey, I'm around. Can we just meet up for dinner or whatever? And, you always just pick up where you left off from. Like nothing's changed, even though we're all busy with our lives. With work, with kids, family, and things like that. But it's like nothing's changed, and I can always count on that, my friends. So that was, the highlight of my kind of education there, I guess.
So I know that you were a music scholar. So what did you do as a music scholar? And what kind of music did you make?
I was a violinist and a pianist.
Oh, wow.
And again, it's going back to that very stereotypical Asian upbringing, I guess on the spectrum, my parents are more tiger parents. I'm not commenting whether it's good or bad, but for me, it was probably a good thing because I'm a bit more relaxed in life. But yeah, I definitely enjoyed it. I can see how it's giving me a lot of skills, including skills for being a surgeon. I read somewhere that people who learn musical instruments might have more surgical dexterity and like hand-eye coordination, which may or may not be true, but I like to think it is true. But it taught me a lot, and it gave me a lot of good opportunities to work with people, whether it was in solo work, chamber music or orchestras. But a lot of it was very much hard work, which was, the Asian kind of upbringing. And I guess, I did well in it, I think, to an extent. But when I got to school, I was a music scholar, but I met the other music scholars, and I realized what the difference was between hard work and real talent. Right? And I realized that some of these guys were like, wow, these guys are going to be musicians. They're going to become maybe professional musicians. And, I'm just very glad that I had the experience, that exposure to be on the same platform as these guys. But I realized that actually, I didn't have quite as much talent as these guys do, who are, naturally gifted,
Yeah.
But yeah, so I did enjoy it. It taught me a lot. I carried on for a little bit during university, but I quickly realized that it wasn't for me. It was fun, but I could only take it so far. I often look back and I wonder whether it would have been different if I'd been jazz trained, because I do love jazz music. But I don't know. I think in the end I realized that I had too many things going on with med school studying and working, because I love sports as well. So something had to give, and I think I'd done enough with music, for me. So I was like, I'm gonna take a break from it for now. But now that I've got my own kids, it's funny because now they're very into music, and it's funny for me because it's kind of like a love-hate relationship thing. I don't want to push them. Like I was pushed quite hard. I don't want to push them like I was, but they seem to have a genuine interest. Yeah. And I'm almost a bit scared to kind of like go back to it. It was a very odd relationship, which I'm still trying to work through, basically. Yeah. So
what is your favorite genre? Is your favorite song Eyes, Eyes, Baby?
Oh, that is terrible. But although yes, I think, I don't know, just when I was growing up, I think hip hop and R&B, rap was definitely one of my genres, but I can appreciate everything. Indie, just anything really. But if I had to pick one, it would be hip hop, R&B kind of thing.
And R&B.
Which I think is not quite the same as it used to be anymore, but there's still some good tunes out there.
So can you tell me about your time at Imperial? What was that like?
It was a lot of fun. I think Imperial so it wasn't a collegiate system like Oxford or Cambridge. So we were right in the middle of London in South Kensington, and it was an amazing experience because it's unusual and unlikely for you to be able to stay somewhere like South Kensington. It's an incredibly posh area, but it was lovely. And I guess it's quite a big, it's 300 and something students per year. Oh, wow. So quite a big year, quite a lot of people. And around a third year, we have an intake from Oxford and Cambridge to come for the clinical years as well. Again, lots of fun. And I think it was just being in London. After you have to move up from halls in the first and second year, you have to kind of go get a flat and, rent out with your friends. And it suddenly seems very grown up. You're paying rent, sharing rent with your friends. You're kind of, well, in the clinical years, you're basically going to hospital, going to work every day.
Yeah.
So it felt very grown up, you know, whether if you're in London, you take public transport, you had to go to Oxford, I had to drive out to Oxford every day. So a very cool experience. I met a lot of, my best friends now as well from university, and we try and keep in touch, right? I know everyone's busy. But again, yeah, I mean, and obviously I met my wife there as well. So all good things, all good things.
So I know you spent a year at the Imperial College Business School. So what was that like?
So that's the equivalent of the Hong Kong U's enrichment year, basically. So back then, I don't know if it's the same now, but back then in fourth year, we called it the intercalated BSc year. And they had a couple of, I think they had about a list of about 10 programs there. So it was split between specialties. So surgery, if I remember, I don't know, immunology, endocrinology, things like that. You know, one of the choices was healthcare management with the business school at the time there. And I think at that time I was going through a sort of slightly off period with medicine, shall I say. I think, you know, the first 2 years were tough, as most preclinical years are. And I was a little bit, I don't know, under this kind of unhappy cloud with medicine. I can't wait to leave. I want to go do something else, do something, you know, a bit more useful. And at the time, a lot of my friends who were not in medicine were doing, you know, finance things, banking things. They had just started to go to work as well, and hearing them, you know, talking about making investments, traveling around the world for meetings, blah, blah, blah. I thought, oh, that's what I want to do. So the business year sounded similar along those lines, and in my mind, I had all these ideas. I'd be, join a consultancy firm. At the time, the big one was, I think it was McKinsey. Everyone's, be a healthcare consultant for McKinsey. It's going to be so cool. And I was like, yeah, that's definitely what I want to do. Not knowing anything about it at all, but I mean, that was in my mind what I thought I wanted to do. But that was really good, because actually that year, a lot of other students from other courses, like the engineers, the biomedics, also came into this course as well. And we studied together. I made some really, you know, good lifelong friends from there. So that was a good breather for me. It was tough work. But I guess that's the equivalent to the EY year in Hong Kong U. And I think at the time you could have written to other places to see if they could take you on for other courses, but I don't think it was quite as well established as it is probably today, and as Hong Kong U is today.
So is there any advice you'd give to students who are maybe choosing for their EY?
So yeah, I have a lot of mentees right now at Hong Kong U Med. A lot of students who are attached with me in clinic and surgeon. I always tell them, you know, this is your 1 year to really figure out what you enjoy. Even if it's something like volunteering somewhere or charity, it doesn't have to. You don't have to come back with the qualification. If you do, it's fantastic. You know, well done. But if you don't, I think that's also okay. You know, I think it's the experience that really matters. I keep telling them, you know, once you come back to your clinical years, your intern year, it's not game over, but it's like, you know, your life is not going to be on pause anymore. It's go, 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 go until you, I don't know, exit or fellow, which is quite a scary thought, you know.
That is a scary thought.
It's like no more like summer holidays or big holidays. It's going to be nonstop. But pick what you want to do, what you're interested in, you know. And personally, I would go for something very hands-on, if you know what I mean. So I know some guys went to, I don't know, some kind of, where was it? Some things like Médecins Sans Frontières, things like that, you know, where you get a lot of hands-on experience of volunteering. Well, I think that's always very useful, you know, just so you're there, you breathe it, you live it for a while. I mean, this is probably one of the chances in a lot of students' life where they actually move away from home for a year, you know. And we all know Hong Kong is quite a small place, you know, it might be a little bit, everyone can make it a little bit claustrophobic sometimes, you know, families have a big role in everyone's lives in Hong Kong. So just taking a year to be able to move away from that, out of your comfort zone, living your own life, I think that's going to be a real genuine experience for a lot of people who haven't had the chance to move away from home. So, I mean, just do whatever you enjoy, you know, but just make sure you enjoy it, you know. I think that's important, you know.
So you mentioned MSF. Have you ever worked there?
I haven't, no, not myself. Let me see, but anything similar? I do some volunteering work here and there. I do the auxiliary medical service in Hong Kong, things like that. But not like MSF, I'm afraid not. No, I haven't.
So what was it like working in the NHS?
I really enjoyed it, you know, actually. I know it's not, how to put it, diplomatic. It's not in a great place right now. But when I was there in the moment, this is going back, this is 2011, when I graduated and did my F1, the house officer year. So we went to Liverpool, and I think, again, just really by chance, we had about 30 F1 doctors, and everyone got along. And we had come from all different parts of the UK. And I really enjoyed it. I feel like I had good teams. My seniors at the time really took us in as if we were, going to be their junior for a long period, even though it was only 4-month rotations. But I learned a lot, and I was very lucky. I think if I remember, I had vascular surgery.
Oh, wow.
I'm trying to think now. Vascular surgery, geriatrics, cardiology, orthopedics, A&E, and neurosurgery,
Wow.
ICU. And every team I had, I was very lucky. I had a really good senior, and I think that the main comparison I can have between Hong Kong and UK is that in UK I was very much an essential part of the team. So let's say, for example, in geriatrics, I'd be expected to know all the patients under that one consultant, know their latest blood work, print it out, write it in the notes beforehand, have those conversations with the patients' families, and report back every morning. That was my job, to report back. So what's happened? What's the update? What's the newest concern? And I felt like I was an integral part of the team, which in retrospect was an amazing experience. I really felt I was useful to the team. In Hong Kong, I think there was just a slight, again, I know it varies between teams and hospitals, and especially then, I know there's been a chronic lack of interns in Hong Kong. But when I was there, I felt that I was very much made just to do all the homework, as we call it. I really didn't feel like I was part of a team. There were one or two which I did, and that was great. But on the whole, I felt like I was very much just turn up, do all the blood taking, rewrite the prescription charts, or input them into the CMS, and then wait for the seniors to do the ward round, generate the next batch of homework, and just get on with it.
Yeah.
I think maybe at the time it was my second internship already, so maybe I wasn't as keen. I know a lot of my colleagues at the time actually made the effort to do the pre-rounds before the main rounds, but which is a great practice. I just felt sorry for the patients who got woken up at like 5:30 or 6 just to be having pre-round. But I think that was the main difference. I just felt I was a lot more involved. Instead of just doing jobs.
Yeah.
Again, I'm not saying in a positive and negative ways. It was just the differences that I observed since I've done both.
So maybe that was more of a culture shock then.
That was definitely more of a culture shock for me. I didn't feel like I had many patients that I could really get into, I didn't feel like I had a very, genuine relationship with my patients in Hong Kong. There are one or two, obviously, but in the UK, I felt like I can still remember some of the patients' names in the UK. Very odd.
Wow.
I really can, especially the ones who were on the ward for a long time. And I was deeply involved with their family. And once, if they did pass away on the ward, I'd still remember their names and what I did for them. And if I saw their family again, I remember one particular person, after work, I was in the local supermarket, walking home, and I bumped into family members.
Oh, wow.
And then I remembered, the family just passed away, and it was a bit awkward, but it was still very nice. So they remembered who I was and what I did for them, and it was very meaningful, I thought. Whereas in Hong Kong, and the volume of the numbers of patients, I get that we have to do all the homework, do all the jobs. It's important, but getting to know the patients, I felt there wasn't much chance or opportunity. But I think that was probably something which gets covered once you get into your MO years and things like that, which is probably a good thing as well.
So you came back eventually. So what made you came back?
Yeah. So my parents and my wife's parents are from Hong Kong originally, and I think they moved when they were 18 for universities. And my parents actually met in the UK. And then I think once we graduated med school, we were working. We met a lot of our parents' friends and my uncles and aunties, and I was asking, you moved to the UK now for like X years, I don't know, 40, 50 years. You're happy? And a lot of them actually were happy, but a lot of them were actually had this regret that they never tried Hong Kong. Because they're from there originally, and then everyone goes back for the holidays, there's family and friends here. And it just dawned upon my wife and I, look, I don't want to turn 40 or 50 and actually, I've never tried. So why not? I think we've been blessed that we can both speak the language, we understand the culture, we have a lot of friends and family here. It's not like a very alien place to us. It's a second home to us here, right? So we were like, let's try, And then I applied for the exam, and very luckily managed to get through the exams. I know it's not easy. I was just super lucky. That's the honest truth.
What was the licensing exam like?
Tough, really tough. I think the first part's the writtens. So my advice for that, if anyone's listening, who wants advice, is to do it as soon as you can after your finals, your med school finals, because you're examined on everything, you know. You have medicine, surgery, psychiatry, O&G, peds, everything, you know. At the time, I was also studying for the MRCS in the UK, so I think my surgery was fine, but I had to revise pediatrics and O&G. And it was tough, but I managed to get through. Just lucky. That involves just a bit of book work. So doing as close as you can to your finals would be sensible. If you get through that, then it's the OSCEs. This is where it gets really hard. I think again I'm lucky because I feel like, again, this is all very unofficial and only my own interpretation of what happened. But I feel like if the examiner could see that I could speak Cantonese with the patients, you know, fluently, I can make the patient feel at ease. I think they understand. I can speak the language, it's fine. I understand their culture, it's fine. And then when I report, you know, summarize back to the examiner, I'm using English, and they can hear that I can speak English with a sort of English accent. They can kind of guess where I've come from. So I think that helped me a lot, basically. So I managed to get through that. And again, super lucky. I know it's probably better now because I think there are 2 sittings each year. I know there are a lot of alternative routes back, so you can, you know, if your university's on the list of recognized establishments, you can come back, do your training here. If you're already specialized, you can come back with your specialist, sort of like specialist registration, you know, and there are more routes now, so it's definitely easier. But back then it was once a year. And I remember, I think for the OSCE exam, I literally had to trade a few night shifts with a few really good colleagues, and I came to Hong Kong straight after a week of nights. But it was the only way I could fly. You know, there was no flexibility around it. You just had to just get on with it. But yeah, so it was hard. But I'm glad I did stressful. It was, yeah. But then that's the thing. My wife and I were like, we really wanted to do it. So I gave it 110, and you know, I luckily got through it.
I'm glad that worked out for you.
Thank you. Yeah, I'm glad. I mean, we wouldn't be here today if that didn't work out. Put it that way. My wife is interesting. She actually didn't. She knew for a long time she didn't enjoy clinical medicine during med school as well. But everyone told her to finish the studies, practice as a junior, and then make a decision again. So she did. You know, so she was with me in Liverpool practicing. But at the time, the point that we realized that we wanted to try Hong Kong, she didn't apply for the licentiate exam. But she had always enjoyed the legal studies, the legal modules at med school. So she applied to study at the JD at Hong Kong U. So she's now a medical legal solicitor in Hong Kong.
That's incredible.
Yeah, she's one of these like fantastic career women. But she's and I think she sees it as her own subspecialty, right? As I do ophthalmology now, she does that. So it's good. You know, it's worked out, and I know how lucky we are.
You mentioned the list of schools. So what do you think of the recent relaxations?
I think it's a good thing. I think it's I think there were a lot of sob stories when I was doing it. There were a lot of people who were from Hong Kong who couldn't get back. You know, they were from here, you know, and they did med school over there and struggled to come back, which was a shame. But some of them were actually married or even had a kid.
Oh, wow.
And they couldn't do the exam, so they were long distancing for like, I don't know, a few years. So I think having these new routes to come back is very good. I think that's probably for these people who need to come back for their families or whatever. And I mean, and as you know, I think Hong Kong, there is always a need for more doctors. So I think it's a good thing. The actual list I've not seen myself, but I think it's quite a big list, I think.
It is quite a big list.
It is, okay, well, that's good. Yeah. It's a good thing.
So what was your journey like from secondary school into medical school?
The journey? This is an interesting question because I feel like the golden period of my education was actually by boarding school. Just we had such a great time, you know, at that school, and we had so many opportunities given to us. And just boys being boys, you know, it was so much fun that when I got to uni, it was like a little bubble had been burst, like this kind of like this time of, you know, no pressure, no responsibilities, just focus on your studies and your friends, and you have a good time. Suddenly, you know, you're going out into London, living by yourself. I mean, the first year was still in hall, so it was still kind of a bubble. So that wasn't too bad. It was after that, I think, when you moved out. Yeah,
you've got responsibilities.
Yeah, and suddenly I'm responsible for the rents, I'm responsible for all the bills. I'm managing a car and stuff like that. Obviously, my parents were there to help with a lot of it. I won't try and pretend that I did it all myself, but it was a nice transition of kind of growing up. I do feel like we were maybe spoon-fed a bit too much when we were kids, but now that I'm a parent, I mean, I guess it's the norm for parents to spoon-feed your kids. But we kind of learned through it, and I think we had a good bunch of people to help us with that. So again, very lucky. It's a great bunch at school, a great bunch at med school, and we all learn off each other basically.
Do you ever wish you could have stayed in the UK or wondered what it would have been like?
Yeah, I mean, it's something we wonder all the time now, actually, because now that we're now 10 years or having moved away from here, now we have kids here in Hong Kong. We do, when we go back, I mean, just recently we went back to the UK to see family. I do look around, I wonder, what would it be like, But then I realized that although I was born and raised there, I feel like Hong Kong is very much my home now. So many new friends and family here, our jobs, our careers, our kids, everything is here now. And if I say I miss UK, I've realized I don't miss the UK particularly. It's more like I miss a certain point in time in the UK, if that makes any sense.
Yeah.
So if I could have one day as a 16-year-old back at boarding school, or if I could have one day, as the junior doctor in Liverpool again with that same bunch of people, that'd be amazing, right? But now everyone's gone, everyone's gone to different paths. No one's going to be in that same place, as it used to be, Everyone's gone around the world, around the UK, and it's I guess it's part of growing up. Everyone's got different responsibilities and things. So yeah, I mean, I miss a place in time, put it that way, more than the UK itself. But I mean, there's things I miss about the UK. The big parks, a good cheap pub. That's what I miss about the UK. But yeah, I think the world's a smaller place now, and I feel like travel is a bit easier. So. Yeah, no, I think back and I'm still pretty happy where I am now, to be fair.
That's nice. So if you were to challenge someone to visualize something beautiful about ophthalmology, what would it be?
Oh, that's a good question. I mean, the reason why I enjoy it is I realize I've always liked surgery. I realize I like using my hands and I like video gaming. And then for me, actually, apart from plastic surgery, I would have really enjoyed neurosurgery, which I thought about several times. Big surgery, but when I did the neurosurgery ICU rotation, I realized how some of the outcomes were not always great. You've done a great surgery, it's successful, but actually the patient's kind of quality of life or that person may not be the same anymore. And I felt, that kind of shook me a little bit, right? And then once I discovered ophthalmology, and again, it was challenging surgeries, but I felt the outcome was probably consistently a little bit more satisfying at times.
More rewarding.
More rewarding, yeah, but just doing a cataract surgery. It's relatively simple compared to a big neurosurgery, but the outcome is pretty immediate. It's pretty tangible, and patients' quality of life is suddenly, much improved. And I think that kind of tangible outcome of your improvement in quality of life, I think I found that quite nice about ophthalmology. I think that's probably what I'd say would be the most beautiful thing about ophthalmology, really. Yeah.
That is quite beautiful. So, can you tell us some more about oculoplastic surgery?
Sure. It's kind of about the external parts of the eyeball around the eye. So the eyelids, the bits within the orbit, any tumors in and around the eyeball itself, any fractures of the bones around the eye. And then we usually do a lot of people who have thyroid problems. They get thyroid eye disease where the extraocular muscles are very inflamed and thickened. And it's our job to kind of decompress the bone around the eye to give it more space so that the eye pressure isn't as high, they don't have such bulging out eyes and things like that. Plus, a lot of the work that we do, recently we can also help neurosurgeons where if there are some very anterior brain lesions, you can actually access them from the orbit, so we can get access through the orbit for the neurosurgeons. So it's kind of it's meant to be oculoplastics and orbit surgery. In Hong Kong, I feel like oculoplastics is very popular. then there's a lot of it should be everyone's bread and butter, to be honest. So everyone should be able to do, a TOSA surgery, entropy, ectropy. These are kind of our standard surgeries, and everyone can do it and can do a really good job of it. And there's a real nice overlap with that and the cosmetic surgeons, the aesthetic surgeons, plastic surgeons, and the orbit side of it is a bit more niche. Not everyone does that, I think. The training the training route is harder, but again, the caseload isn't always huge. Not that many people need the help. And I actually just came back from Los Angeles. I was on a orbit cadaver dissection course to try and help improve my skills. And it's great. I think when you've got enough when you had enough exposure and experience, then you're more comfortable with doing it on a real patient. I've had great seniors teaching me over the years. But again, because the caseload isn't always huge, and not everyone needs surgery, it's not like everyone's going to get an orbit surgery, right? So I think signing up for a course, this cadaver course, was great in helping me, feel more comfortable with my skills. I think for any surgery, I think that's always a good. Well, for me, I've realized, as you can probably from the gauge from the interview, I'm not the most studious person. I don't learn well from reading or watching online lectures. I'm a very visual or tactile kind of learner. So for any surgery, I would recommend going on cadaver wet lab courses. I think hands-on is for me the best way to learn.
I agree. So as an ophthalmologist, what do you think of LASIK surgery? I see that you're wearing glasses, so would you ever consider getting it yourself?
I mean, it's really very popular now and genuinely very, very safe. I wouldn't do it to myself because my view is a bit skewed, right? I know it's like, don't quote me on this, let's say it's 99% safe. Let's say it's 99. In my line of, I see the 1% that goes wrong all the time, right? So that's skewed my kind of opinion on LASIK.
That's
but
true.
On the whole, it is safe and it is life-changing for a lot of people. But for me, I've worn glasses all my life.
Take that risk.
Yeah, I mean, and to me, I mean, like I've worn glasses my whole life, and I do a lot of sports, and I can do them with my glasses on.
Wow.
So
I see.
I'm not really that bothered.
So it doesn't really affect your quality.
No, it doesn't bother me to the point where I think I need to do LASIK to improve my quality of life.
I see.
Oh, yeah.
Sorry, that was eye-palling. So, is there any detriment to wearing glasses all the time?
Not that I can think of. I mean, for children, you have to wear the glasses. I think what you're trying to say is that some people believe that if you wear glasses as a kid, you get worse and worse myopia and stuff. It's not necessarily true. If you don't wear it, then you will actually have problems with your vision, especially as a child. So you need to wear your glasses for sure.
So what do you think of not wearing sunglasses?
Not wearing sunglasses, especially somewhere like in Hong Kong, I would probably recommend it. The sun is strong out here, and if you're outdoors playing sports or near the sea or whatever, it does damage your eyes. So I think you should, from pterygium to cataracts to macular degeneration. And these are things which have been proven to have links to having sunlight exposure. So somewhere like Hong Kong where it's super sunny, I think you need to wear it when you're outdoors.
So we hear a lot about screen time nowadays. What do you think? How do you think it affects our eyes, and what can we do to prevent the kind of effect that it has?
For children or for adults?
Both.
Both? Okay. I mean, for children, it's I think important. We call it a visual hygiene. So it is important every so often you take a break from your screen, and it's getting difficult because obviously a lot of learning is done online now. Through iPads or your phone or the laptop or whatever. So it's inevitable. We're not going to not be on the screen, especially for our children who have to be, very, computer literate eventually anyway. So you can't avoid it. So therefore, let's just be mindful of visual hygiene. So taking a break. Blue lens filters, I personally don't know much about these yet. In theory, it makes sense to block out these like harmful long wave blue light, but what actual effect does it have on the eye? I mean, I don't think there's any solid evidence yet. But I mean, if parents are worried, then wear them. There's no harm in wearing them, right? But what I'd say is just keep that visual hygiene in place, especially trying to be outdoors more, so have a balance. You do your homework, you're watching Netflix or whatever, YouTube, then make sure you go out for a bit too. Go out for a walk, do some exercise, do some sport. I think that's super important. not just for your eyes, but for the kids' kind of sense of that you can't just be on a couch on a chair the whole day. You need to be up and about to get a pretty healthy lifestyle, influencing them to have a healthy lifestyle kind of thing. For adults, again, it's we all like to think that it's harmful staring, but I think we all do it. We've all been in front of our iPads before bed watching something for 2 hours. Is it harmful? Probably, in some way, probably, but it's hard to convince you not to do that, right?
That's true.
It's like I don't think anyone really knows enough about it yet. Like for example, smoking. Obvious links to cancer and stuff. So convince you to stop smoking, fine. But even that is hard enough, for someone to be convinced about to stop smoking, right? I mean, so now telling them you can't use your iPad, it's going to be pretty
Especially
difficult.
because everything revolves around using these devices.
Exactly right. I mean, sure, we're going to get tired, we're going to get dry eyes just by staring at the screen. There'll be blink less, but staring at something intently for a while, you're going to get tired, But again, just be mindful, every 20 minutes or so, take a break, go for a walk, have a drink, go outside, be outside for a bit. I think not just for your eyes, but for your entire system. I think it'll be a bit more healthy, I think.
What are some top eye pathologies that you see in your everyday work, and how do you think people can avoid those?
Eye pathologies I think ophthalmology predominantly is a specialty where the pathology comes out in older age. Not everything, but the bulk of it would be. And what we see every day is cataracts. Everyone at the moment will have cataracts, and everyone will need cataract surgery eventually. No one's found a way to stop it yet developing. At one point, there was someone who came with a drop, which could slow down progression. So I've not looked into it properly, but I don't think the data was significant enough to say it can definitely slow down or stop cataracts. It's too many multiple mechanisms of cataracts happening. So again, one of them was being sunlight that we mentioned before. People with diseases like diabetes or been on steroids, things like that. It's hard to pinpoint one mechanism to stop it. But that'll be the bulk of our work, and determining when people need to do their cataract surgeries. Things like glaucoma, we see a lot of, especially in Asian people, and managing people's eye pressures. And that's probably where a lot of work goes into, because glaucoma is a silent disease, essentially, and often people present when it's too late, which is a shame. So getting your eyes checked regularly, once a year is important, I feel. Especially if you have a known family history of glaucoma, then definitely getting a check. Just at the opticians, the eye shops, they all can do a pressure check and have a quick look for you as well. And if they find anything, they're great at sending any sort of suspicious reports to us as well. Glaucoma. So for I do all the eyelid stuff. So especially droopy eyelids. Once people are slightly older, they get ptosis or dermatochalasis, where the skin of the upper eyelid, but the actual eyelid itself, comes down and blocks the visual access. Very easy to fix, and it's relatively a very simple surgery, and that can change someone's quality of life, significantly, which is great. Those are probably the bulk of what we do. Oh, and AMD, so age-related macular degeneration. So again, most people have some form of it, whether it's usually in a dry form, which is just deterioration, like having white hair, essentially, right? Not much you can do. But if it becomes into the wet form where it bleeds, then you significantly just have an acute loss of vision. And you need to get checked out sooner than later. And so we do a lot of injections into the eye to help prevent AMD and try and get rid of the blood which is inside the eye, basically.
So eye checks and
eye checks. I think so. And a lot of people are often very scared, or they don't want to address the issues that they might be having. I'll go to bed for a bit and see how it is tomorrow. That's usually what we hear a lot of. But yeah, I think if you do feel something is odd, I think getting it seen earlier is much better than later. So
Okay, so you're a trainer in clinical simulation and microsurgery. So what would you say your teaching philosophy is?
I really like to have what I call kind of like a lot of hands-on approaches. So for the student to have a lot of hands-on approaches, be in the moment. I was saying earlier about the tactile kind of like learning. I like to try that with my students, and I've learned role play as well. It's really important. So when I was lecturing a bit for Mehu the medical ethics humanity unit, I'd always, I don't know if some people might remember, but I always make up scenarios for patients, for students to pretend to be a patient, to be like a junior doctor, and I'm like the angry patient, and it's just fun, you know. It makes it just it really gets them, you know, kind of the head straight into the scenario, and it's in a safe environment, you know, and we are having a bit of fun, and it always ends in laughs. But yeah, for those few minutes where I'm being a very angry relative or something like that, you know, you can see the students sweating a little bit, right? And I think they for a moment they feel what it would really be like, and I think they'd learn a lot more from something like that, like an experience, than me talking to them for like an hour. So I try not to talk too much, whereas, you know, we try and show them or let them, if it's in surgery, let them feel it, let them see it for themselves. If we're doing small group, I like to do, so the role play scenarios is quite good, I feel. So I think that's probably my approach, and that's why I really enjoy like when I was a simulation a trainer, because that's, you know, I guess role play in its finest form, you know, where you've got you know, the dummy who's the patient, but you've got all the fake blood pressure readings, the heart rate monitors, the ECGs, and just getting the student to respond appropriately, or seeing how they don't respond initially, and then trying to guide them, or if they redo it later on, you know, it's always a lot of fun. I feel like they take away a lot more from that than just talking, you know. So,
what made you decide to teach?
Oh, interesting. I've just by chance, I feel like at uni, and then at med school or as a junior doctor, for some reason, we were always embedded with a culture to teach, to pass it on. No formal kind of, you know, organization. Just, if you're around, like you see a bunch of students, you guys okay? Do you need help? Do you want to see some signs in this patient? That was always part of the culture. And I think I've just carried that on throughout my time. I think, so when I first came back to Hong Kong, the intern year was tough. You know, I did manage to see some students. I taught through a few clinical signs. In my first role was when I did my residency, I was in a non-university affiliated hospital. And we didn't have that. We had a few, but not many students with us. And I think during that time, I was busy with fatherhood, with exams, the ophthalmology exams. I think I forgot that I really did enjoy teaching. And it's quite funny because this kind of goes full circle now to where I am today, because I think last 2023 December, I think I came into Grantham Hospital, which is part of Hong Kong West and Hong Kong U, to help because they didn't have anyone who did oculoplastic and orbit surgery. So I came to help. And then there were lots of students attaching, and I was like, wow, I really miss this feeling of teaching. And I think I spoke to, you know, you guys, everyone knows Kendrick. So I spoke to Kendrick, and I was like, hey, you know, I really miss teaching, I really enjoy it. And Kendrick told me about this role at Hong Kong U. And I was like, great. And so here I am today. But I think I just had really good seniors back when again, very lucky. I've always been very lucky. I think I've always had these great seniors who've always just taught me so willingly, you know, and so, not for any sort of, not for, how should I put it? Not for any sort of benefit on their part. It's just really just to keep passing it forward. And I actually have one senior I'd probably like to mention. His name was Mr. Raj Bhutiani. So his son was at Harrow with me. We went to med school together. And then, unfortunately, his son didn't make it through med school. Different story. But then Mr. Bhutiani, he's a general surgeon at Imperial. He was this old school Asian surgeon, you know. I think in Hong Kong the term is a very malignant, teacher, and he was. But this kind of old school training whipped us into shape, you know. So when we're presenting to him, he'd just tear us apart. Like, what are you talking about? Please do it again. And he'd do it in front of the entire class, in front of the patient. Yes, it was nerve-wracking. But it was always done with a slight humor to it. So it wasn't for the reason of disrespecting you or just trying to make a fool out of you. It was just, you know, this is how you're going to learn, because now you've said something really silly in front of all these people and I picked you out on it, you're going to remember. So you're not going to say it next time. And it was always done with that little bit of humor, which made it okay. I think it's a fine line, right? But I think it was always okay. And I learned a lot from him, you know, and it was a real role model to me. I think that's it. I've always been very lucky with role models in my education. And unfortunately, he passed away from COVID a few years ago. So that was a real shame. But I know I'm not the only one who's been inspired by him to carry on great, good work in the public sector. I know there are lots of us, and it's thanks to people like that who, remind us of what's important and where our priorities lie. And I think that's, if I could try and do that for students at Hong Kong U, I think that would be amazing if I could pass this forward. And it's all, because of him, I remember he told us a really good story about being like the humble mango tree, right? There's two types of mango tree, the really tall one, which is really proud, or the really humble short one, which, bears a lot of fruit. And he said, be like that short mango tree. You don't need to be so tall and proud, You have a lot of fruit and share it out to everyone. Be that. That's more than enough. I think I'm finally understanding it now, So if I can try and be like him, that would be amazing.
So just building off of that, what would you say is a really important value to keep in mind as a medical student or as a medical professional?
Oh, wow. Great question. Deep question. I think remembering to be human. I think it's super important. I know they teach you that during ethics and humanities. And it's easy just to say it, but I mean, we all know that being a med student, being a junior is always tough. You always have loads of exams, and then as a junior doctor, you're just doing exams and you're practicing, doing all the homework, as we were saying earlier. But there's always, once in a while, you have that one moment or so where you need to make a decision, right? And you might be tired, you might be angry, frustrated, but just remember that whoever is on the opposite side of you, whether it's a patient or another student who needs your help, that they've come to ask you for help. You've got your troubles, they've got their troubles. We don't have enough time in the world to understand each other completely, but if you've got the skills, the time just to help someone, just try your best. I guess it's trying to remember you're there to, I guess, whatever you've been so lucky. We've all been so lucky to be put in this situation now, being through med school. I think all our parents did incredibly well, to get us into med school. Now we're here, we've graduated. You've done really well studying. It's about remembering why we did it. What was the point of all this, and just kind of passing it forward and just giving back. And especially in the public sector, which is where most of my experience comes from. That's what it's about, just focusing on that person in front of you and just helping them out, regardless of what's happening outside in the bigger picture. At that moment in time, that person's in front of you coming to you for help. You may or may not have the skill set to help them. If you don't, then ask for help. Nothing wrong with that. If you do have the skill set, then just do your best, And if the situation, cuts it short or makes it difficult, then just communicate that, to the patient. I'm sorry, I'm in a rush. I'm sorry, I've got other things on my mind, but I'm trying my best, And I think that if we can all try and remember that, I think that will, solve a lot of problems that we have today,
That's very profound. So more practically, what would you say is one hard skill that's really important in your everyday practice?
Ooh. Time management. I think that's I think one thing which we like to think we control, we understand, but actually it's very difficult because again, you're going to be pulled in all directions as a med student, as a junior doctor, as a senior, and you need to understand how to prioritize. I'm still struggling with that too now, because now as a father, now as a faculty member, and as a clinician, as a teacher, as a mentor, I've got so many different parties pulling me in different directions. I have my own interests, I still want to go play tennis, I still want to go swimming, but it's trying to remember that there is a priority line, and that unfortunately it's not just about yourself anymore. You've kind of signed an agreement or entered this kind of understanding that you're going to be there in this role to help people, to be a father, to be a husband, and I need to learn to figure out, I need to give, where to go first, I mean, you could kind of formalize it on paper, like a trauma core, like an A&E, you need to do airway, breathing, checking. But I don't want to be so robotic.
Yeah.
Sometimes there is a bit of give and a bit of push. You can flow through things a bit more naturally. But I think if you can try and find a way which helps you control your time and prioritize things better, then I think that's a very important skill to have.
You've mentioned all these different roles that you have. So how do you juggle them? So how do you keep the work-life balance?
I think that's the thing on everyone's mind. I think how to keep that work-life balance, and it's not easy. It's not easy, but I think it kind of goes on from what I was saying about prioritizing. And again, I think if you know you're going to fall short, or you're not going to be able to come through on a promise or a previous meeting or something like that, then communication. I think it's always important. I think that goes without saying as a doctor, as a med student, to learn to communicate effectively and efficiently. Timely communication as well. Not just in the clinical professional setting, but even at home. So if I'm stuck at work for something, I need to make sure I can communicate to my family that I'm not going to be able to pick up my kid, or I'm not going to be able to go to this event with you. I need something else takes priority. I think if you can have timely, open, honest communication, I think that's probably the way to go through.
Communication is key.
It's key. And I think I'm probably taking one of your questions, but I think one of it was probably going to be about how's AI gonna affect us, right? I think once it's more mature, I think it will be very useful in many ways. I don't think it's quite there yet, or the parameters haven't been set yet to be very useful to us yet. But once it is very effective and efficient, it probably will replace a lot of what we do. But I like to think that there are some things that it can't replace, and I think one of those was exactly what I was talking about. So communication, communication, teamwork, leadership, languages. Of course, there's lots of open interpretation devices now, but being fluent in language to put someone at ease, is much better than using your phone to translate in between an interaction, right? And it's all these kind of EQ values, which I think AI will never replace. And I think now, well, at the students at med school, or even kids at primary school, secondary school, I feel like that's where the emphasis should be on. That learning EQ, pushing those boundaries of EQ would be way more important than IQ. Of course, IQ, everyone needs a baseline. I get that. But then everyone now also has a smartphone, and actually a lot of information out there is quite accurate, right? So for me, I feel like the role of a clinician has probably changed somewhat. It's changing now, that we're no longer just, these kind of harborers of answers and information, because it's all out there. We're helping people navigate how to use this information, how to pick the best option for their circumstances. So for example, if someone has thyroid eye disease and they may need a decompression, the patient already knows. Some of them are young and computer literate. They know what they need, right? But it's my job to help them kind of get through, well, what's best for you right now. Where are the imminent dangers? What's going on in your life? What's your priority? What's my priority? And we kind of have to communicate, right, to match that, to make a decision. So I think that takes actually a lot more EQ than IQ. I think that's super important.
So what do you think of Dr. Google? So people looking things up and maybe self-diagnosing before showing up in a doctor's office?
Oh, that happens all the time now. Any patient with a phone and a printer will come up to you and show you these 5 things they printed. And I tell them, look, that's all correct. But then my style would be, well, tell me more about yourself. What's happening in your life right now? What's your priority? Are you at work? Do you need to work? Do you need to travel? Do you have kids you need to look after? What is it that's happening? And then I can help you pick, is it A, B, C, D, or E, but they're all right, And often actually, again, being honest and communicating, if there's this novel treatment that they've printed out, which may or may not be right, I'll tell them, I don't know, I'm not familiar with it. Maybe some other hospital, some other country has it, but I don't have it, I've never used it before, and I'll be very open, I'll tell them, I don't know. We can look into it together. I can ask other people, my colleagues who may have experience with it, but I think it's always important to be honest and just communicate. We don't know everything, right? And I think that's important to get to people.
So what does a day in the life look like for you?
A day in the life. So my new role is keeping me quite busy. I'm always jumping around, but I personally really enjoy it. So right now I'm a mix of helping out in the HA, in the public sector. So I do my oculoplastic orbit clinic and surgeries out in Grantham Hospital and Queen Mary Hospital. Then I do some private work for the university, and I'm out in Gleneagles for that. So I do general, or again, oculoplastic orbit surgery. And the other third, I help with the things at Hong Kong U. So whether it's teaching, mentoring, or at the moment I'm doing a lot of these charity cataract surgeries out in the Hong Kong UI clinic. So yeah, and then out of those sessions, mentoring, sorting out my kids, and trying, to chase my own hobbies and stuff.
How about family life? How do you make sure you're present for your children?
So I think, again, prioritizing time is important. I like to think I'm quite hands-on as a dad. So one thing I really enjoyed doing is actually driving my daughters to school. So they did take the school bus at first, but in the end I thought, well, it's actually not that out the way for me. Why don't I do it?
That's very valuable.
Yeah, because it's like, 25 minutes, half an hour just chatting to them in the car, and I'm secretly trying to influence their music tastes, which is working. But yeah, it's just chatting, because often, they have a lot to say. And then when we get home, everyone's a bit tired. They're tired. I'm tired. We might not have the right frame of mind to open up and talk. So that time in the car is very valuable. It could be just talking about complete nonsense, but at least you feel like you've made some sort of conversation with them. And you can actually, sometimes they open up or something. Oh, by the way, I felt the other day, and then you just come up with these random things and you pick up on it. Yeah, and then when I get home, I'm always try to bath them first before it becomes inappropriate for me to bath my daughters. And then bedtime. Bedtime's super important, I feel. So we do the bedtime stories, and then we just lie in there, and then we put them to sleep. And again, it's those moments just before they drift off, they'll come up with a random comment about what happened in their day. And it's just amazing to see. So I'm trying to do those key moments, because obviously during the day I'm usually out, And if there are evening meetings or dinners or with whoever, then, I try and, keep it to, once or twice a week. But sometimes it can't be helped. But, we just try to manage time.
You mentioned you grew up with the traditional Asian parent expectations. So what do you think about those, and what kind of implication have they had on your life?
I think it's probably a story which is probably true for around the world, for a lot of immigrant families, and it's an amazing an amazing force, this tiger parent style, this overwhelming sense to push your child to achieve the best they can. As a product of it, I've done very well out of it, I feel, and I feel a lot of people have around the world. But did it stunt my growth in other areas? Potentially. I feel that's also possible. But I guess it depends on the child. I think inherently I'm probably a bit more laid back, a bit more laissez-faire. So I think the tiger parent style probably helps me in that sense to give me some sort of like order and some sort of direction in my life. Yeah. So I'm grateful for that, But I guess for some kids who are already quite, determined in their ways, I think the tiger parent thing may be slightly contradictory. There's a bit of a tension there, which might not be as productive. But what it has taught me for my own kids is that, again, I don't know if this is right or wrong. We'll find out in 10, 20 years, I guess. But I like to think my children don't belong to me. I feel like, obviously they're my kids, but what I mean is that, I don't want to push any of my ideas or thoughts or my own ambitions onto them. I do believe that they are their own individual human beings with their own ways of thought, their own thinking. I would love them to have that space to enjoy that journey, to think for themselves, what do they want to do. Saying that, though, I now realize why a lot of Asian parents want their children to go into medicine, because it's a very stable job. I mean, if we're going to just put it down just to job, security, I think given these last few years, I mean, it's evident that medicine, is probably one of the most secure jobs, from the age of, 25 to the age of 60 or whatever. If you don't mess up in some drastic way, you're probably going to be in a job forever. And that's very, that kind of consistency is very unusual, for a lot of jobs in this day and age.
That's true.
Right? So I can understand why people would push for that, because yes, now that I'm now at the other end of it and I have kids of my own, I am very thankful that my parents, nudged me down this path, because I can see the security that it offers. Whereas a lot of my friends who are even in law or finance, it's just constant changing, work field is making people redundant, and it's like, that's quite terrifying if you have young kids, who you have to try and support through life. So yeah, but again, I guess I'm spoiled and I'm lucky in the fact that, you know, for my kids, I don't want to push that on them. Let them explore what they want to do. I mean, to extrapolate this even further, you know, let's say my oldest daughter Zara, she's really into dancing, you know, and then I'd love to support her doing that. If she really enjoys it, maybe she's good at it. I don't know. Maybe she is. And, you know, if she wants to take it professionally, I'll be like, oh, okay, but you know, let's be honest. The chance of her making it to a really big, famous, you know, like really successful dancer is quite slim. You know, regardless of how good she really is. A lot of things are right place, right time, right? And then if she doesn't make it big, then what is she going to do? How is she going to support her own life in future if I'm not there to help her, you know, or my wife or I not help to help her? She has to learn that, you know, not everything goes that way. Yeah. So obviously I'm not trying to break her dreams, but we have to be real sometimes, okay?
It's true.
And I guess, you know, if she does decide to pursue this career, this kind of career path, and she doesn't make it big, A, what is she going to do? And then B, if she had her own kids, it might be quite amusing. It might be like, oh, you should be a professional, you know, be a doctor, a lawyer, kind of, you know, for those reasons, job security reasons. So yeah, I mean, I think I don't want to push onto them, but I still understand that need for security.
What would you say is something that your children have taught you?
Oh, wow. I think they've taught me that the days are long, but the years are very short. That's definitely something I've learned. I think they've taught me to try and be, you know, a better person in the sense that just be honest, you know, just be real and be in the moment. You know, I think that is for me very, very important. You know, we're all busy. We have things on our mind. You know, we're playing on our phones. We're networking on our phones. We're thinking about another presentation we're gonna have to do. But actually, being in that moment for that, you know, just whilst I'm feeding them their dinner or something, they're trying to tell me something, I'm not quite there in that moment, and that moment's gone. It's hard to capture that again, you know. So being in the moment is super important, I feel, and I think that's what they've taught me.
If you could go back in time and meet your younger self, what age would you choose and what kind of advice would you give? So I think, as I mentioned earlier, I think my golden time was probably at boarding school. I'd probably like to go back to one of those days. I don't know, maybe not at 13 when you first go in and you're a bit shy and everything. Not at 18 when you're doing too many exams and you know, university applications. I think somewhere in the middle, maybe like 15 or 16. And if I could go back and tell myself, so I'd be like, again, be in the moment and enjoy it, because it's never going to come back, as morbid as that sounds, you know. I think at that age it was, you know, just a great age, you know, not many responsibilities. And for me, just being around, you know, your best friends the whole time, just messing around, you know. We were all nobody, you know. We were just boys, being idiots, you know, doing your sports, doing whatever, you know, just messing around. And it was just so nice, you know. I don't think there's any moment where we can go back to that now. So I just say, hey, just enjoy it, because the number of times it's going to happen is actually quite finite. So yeah, I think that's what I would do. Where is a place in your life that you find the most peace?
Wow. I think I can think of three things. So to keep myself fit, and again, my own hobbies, I love sports. I play a lot of tennis. I swim a lot, and I used to do a lot of trail running. And I think I like it because I think in the moment you're in that sport, you can really zone out, you know. I was going to say tennis, because that's my first love is tennis. But actually, if you're in a game and you're losing, you're not at peace. True. So maybe not that. But I enjoy the game. But I think like swimming. So my wife's a big swimmer, and we were training for the Cross Harbor swim. And so it's not my forte, but you know, I like it now, swimming. And I think just when you're in that moment, you know, you're just focusing on breathing and you know, and just kicking and using your arms, nothing else. And then you kind of zone out. I feel pretty peaceful then. Or, you know, when I used to run a bit more before kids, just being on the trail, being on the mountain, you know, really high up, it's a sunny day, blue skies, you're running, and all you're thinking about is just where to put your foot next, and just enjoying the view. You know, that for me is like, you know, really, really nice. So somewhere like that, I think.
Actually, I have a question.
Yeah, sure.
Oh, lovely.
Can you try to mimic that angry patient intelligence?
Oh yeah, cool.
Oh, okay. Go ahead.
You're a medical student.
Yeah.
Come on.
Okay,
let's go.
so let's set this scenario. So let's say you're the intern. Okay.
Okay.
And let me see. Oh, something simple then. Okay. Someone took my bloods before, but then the blood sample got clotted, and you got to come and do it again. Right. I'm a little bit anxious. I'm like a 60-year-old or something, and I don't want it to be done. Right. Should we do it in Cantonese then? That would be a bit more natural.
Sure.
Sure. Okay. So just say, oh hi, you're乜醫生, and then I can be the angry patient. I'm I can be anyone. 局生 or whatever. You know.
你好啊，我姓黃啊，我而家你頭先個 what the 頭先個blood sample， 我不如
啱啱抽完血嗰個
啱啱抽完血，但係我而家要再抽多次啊，唔好意思。
冇啦，再抽我好痛，我好驚㗎。你明唔明啊？點解要再抽啊？你抽錯咗啊？
唔係啊，但係啲血個 sample 有啲問題，所以我哋要再嚟多次。
咁你再用乜部機，你再做多次咯。點解要再抽啫？我人咁細粒，我唔係好多血啫喎。你抽多次，我真係哇！我心停咗咁你點啊？唔會有啲嘅問題嘅。我好驚㗎喎！喂，係咪你唔夠 senior 啊？揾呢個 senior 嚟幫我抽啦！你班學生仔。Okay, let's see. You see right away. You see right away.
I see how it puts you on the spot.
It puts you on the spot.
It really does.
And the pressure, right? But this is actually very, very real.
Yeah.
This is very real. This is also a very simple example. Just 抽血, right?
Yeah.
But imagine, I don't know, like consenting for a surgery or something like that. You know,
That's true.
But you're already sweating a little bit.
I was like, whoa.
And I could get angry and angry and angrier. And I think my advice, the way to kind of control it is to say, be open. You know, I believe, like I was saying before, be open and just apologize. You know, it's not saying it's anyone's at fault, but it's just empathizing with the patient. I'm really sorry this has happened to you. I know it's causing you pain, but it's really important to do it again because of your condition. And if you don't, I worry something else will happen. I'm really sorry. I will try my best to get it in one go, and I'll send it down to lab straight away, but I can't guarantee it, and I apologize. I know it's late. I know you've had it done. That's what you got to do. Empathy, open communication, apologizing, because this person is still like, a human being who, yes, it might be 2 a.m. He's had 5-10 blood samples done already. He's scared. He doesn't know what he's doing in here. And, so yeah, I think I found that's the best way. It's really
effective.
It is, right?
So what do you think of those, for example, maybe those medical professionals who have more experience over the years, who might be less compassionate in their approach to patients?
I mean, everyone's got their own style. I'm not saying any is right or wrong, but I think, because I think of my wife's line of work, I hear a lot of stories about where things go wrong and where it could have happened. And I honestly feel a lot of situations can be dissolved very early on, just introduce yourself and just apologize. It doesn't mean you're admitting fault. It means you're empathizing. You understand that patient is in a tough situation, and that's already, half the game won. It's when you're a bit less involved, you're a bit cold, and it gets further and further, it's very hard to come back to that point. I mean, drawing from my own experiences, like in an ophthalmology clinic, it's a busy clinic in the HA setting, and we usually often see about 50 patients in the morning from 9 a.m. to 1 p.m. So some patients are sitting there for 2-3 hours, and then when they come in, they probably see you for about 2-3 minutes. So I can understand how they feel. I mean, if it were me, I'd be upset with that. So what I try and do is try and just diffuse the situation. So they're like, 早晨啊，黃太你好啊，唔好意思等咁耐，我姓谷㗎，我哋半年冇見啦，你點啊？ Right? And I feel that took me about 5 seconds to say, but already the patient feels acknowledged.
Yeah.
Right? And he or she knows who I am. She knows that I know who they are. I've recognized that they're upset, they're angry, they've waited this whole morning. And they feel like, but at least they feel like they're being heard, right? They feel like they're being treated with respect as a human being, And it's not the ideal situation, of course, but we're all there to help them, So that's what I would advise.
So just to change the focus a little bit, what's your opinion on compassion fatigue and the erosion of empathy as a result of burnout? Do you think our healthcare systems are well equipped or supportive enough of medical professionals?
I think that's a great question, and it's a real problem which is coming up now. And I have a lot of friends in the UK who are dealing with these kind of issues of burnout. And you're absolutely right. One of the early signs of burnout is that erosion of compassion, the erosion of empathy, and you become very stoned or jaded to these issues, and it can lead to problems, right? I think, especially in Asian culture, I still think there's a bit of stigma attached to it, admitting that you're burnt out, admitting that you're not thriving, that you're not surviving, and I feel that's a shame. Again, I feel like, eventually I'm sure people are working towards having a more open and a safe environment for people to open up and say, hey, I'm not doing okay. And it should be okay to not be okay. It shouldn't be a judgment call on anyone or a reflection on your inability or anything like that. It's just, everyone is under a lot of pressure from work and at home. And then when you're in these very high pressure environments, especially in the public sector, I think, it's very easy to get burnt out. And either it's externalized, which is, the erosion of compassion and things like that, or it's internalized and it can lead to mental health problems. And I think a lot of it is missed in Hong Kong, which is a shame. But I do feel like it's changing. People are recognizing, especially in Hong Kong, US, and there are a lot of mental health services. In the actual workforce, I think it's coming along. Again, I've not been involved myself with this work, but I like to hope it's coming along. And I think people need it.
Have you ever witnessed any negative consequences of burnout in your daily practice? So, for example, maybe the effects on patient care, or maybe the effects on the medical professional themselves and their work.
Yeah, I mean, I think to an extent, I was probably a little bit burnt out myself at some point. So with that kind of 50 patient a morning and then 30, 40 patient in the afternoon, that kind of, if that happens for a long period, of course you get burnt out. You're saying, especially if I'm doing that, I'm literally saying that 80 to 90 times a day, and I think eventually you just get, it makes you a little bit slower to pick up on things. And I think you have this kind of, you have this kind of need to try and cut corners to finish on time, finish early, just to get through it, and it's not the right thing to do. But I think a lot of people feel that, it's been too much, I just want to get out of here. And the way to get out of here is just to finish earlier. Yeah. It's not safe. I don't like the idea of it, but I think it's human nature, I don't think anyone can survive in that kind of environment for that long. So it's good. I think a lot of seniors are recognizing this issue, and kind of keeping the rota a bit more varied. And I think there are more sessions for people to do different things. There are more channels for them to speak to seniors, and I think it's changing. It's good.
So before we wrap up, is there anything else that you'd like to mention or address to our audience?
No, I mean, I'm very new to Hong Kong U, and I just hope I'm a good addition to the team. I'm really here just to help out the students, try and get that kind of sense of community, the camaraderie going. I believe I've got big shoes to fill from some of my seniors who've left in the past. And, I'm hoping to really use my time here to help the student body.
Mm-hmm. So thank you for joining us today and sharing your experiences and insights with us. Yeah. I'm sure all of our listeners and viewers out there, I'm hoping they all found this as eye-opening as I did. Thank you for your time today. It was really wonderful to hear.
Super well. Thanks for having me.